Think back to your last eye exam for a moment. You probably read some letters, went through that uncomfortable air puff test for eye pressure, and maybe had a few drops put in your eyes. Then, your doctor smiled and said, "Everything looks normal. There's a slight change in your prescription. I'll write you a new pair of glasses." And you breathed a sigh of relief and left the office. But what if I told you that during that exam, right at the back of your eye, an urgent warning signal sent by your brain's blood vessels was completely missed, and that this signal predicted a stroke you could experience within the next 2 years? What I'm about to share with you today reveals one of the biggest medical blind spots I've seen in over 30 years of clinical experience. This blind spot is literally hidden in your eyes. And unfortunately, standard eye exams systematically overlook this critical finding. In a moment, I will share with you the critical questions you should ask during your eye exam, how you can assess yourself at home, and 7 fundamental strategies to protect your brain vessels. This information could potentially save your life. But first, let's answer this question. Why doesn't your eye doctor see this vital finding? The answer lies in the structure of modern medicine. Eye exams are designed to focus on visual acuity, eye pressure, and lens health. Optometrists and ophthalmologists are typically trained to look for cataracts, glaucoma, and refractive errors. These are important things, of course. But the small blood vessels at the back of the eye, the retinal vessels, are often only examined if there is suspicion of diabetes or high blood pressure. This is where a significant gap exists. A comprehensive meta-analysis published in the journal Lancet Neurology in 2019 revealed that retinal vessel abnormalities can predict stroke risk by 43% a full 24 months before any symptoms appear. This is a stronger predictor than even a cholesterol test. By looking at the back of your eye, we can predict the state of your brain vessels 2 years down the line. This is because retinal vessels are a mirror of brain vessels. They come from the same embryonic origin and are exposed to the same physiological processes. Any change we see in the retina is most likely also happening in the brain vessels. So why isn't this information included in routine examinations? First, time constraints. An optometrist sees 30 or 40 patients a day. Performing a detailed retinal vessel analysis on each patient would double the examination time. The system does not allow for this. Second, the economic structure. Eye exams are largely financed by the sale of glasses and lenses. Even when retinal vessel analysis is offered as an additional service, most patients do not want to pay extra for it. After all, they feel fine, so why would they want to undergo additional testing? Third, and perhaps most importantly, is a lack of awareness. Many eye health professionals are unaware that retinal findings can predict systemic diseases so effectively. This information exists in neurology and cardiology literature, but has not sufficiently permeated ophthalmology practice. Now, let's examine how you can protect your brain blood vessels through your eye health in 7 points. We will progress from the most basic steps to the most critical interventions. We start with number 7, retinal microbleeds and what they mean. Has your doctor ever said after an eye exam, "There's a small bleed in your retina, but don't worry, it will go away on its own"? This statement is perhaps the most dangerous reassurance you could hear. Retinal microbleeds are tiny pools of blood caused by burst blood vessels at the back of the eye. They are usually painless and do not affect vision, so you may not notice them. But their presence is a clear sign that your blood vessel walls are weakening. The Rotterdam Eye Study followed 6,000 people for 15 years. Individuals with retinal microbleeds had a 2.5 times higher risk of stroke compared to those without. 2.5 times. This is a risk increase equivalent to smoking. So why do these microbleeds occur? The most common cause is uncontrolled high blood pressure. When blood pressure rises, the small vessels cannot withstand the pressure and burst. But it's not just blood pressure. Blood sugar fluctuations, chronic inflammation, and oxidative stress also weaken the vessel walls. What should you do? First, at your next eye exam, specifically ask your doctor, "Do I have any microbleeds or hemorrhages in my retina?" Asking this question directs the doctor's attention to this critical finding. If microbleeds are detected, don't panic, but take action. Start monitoring your blood pressure. Digital blood pressure monitors for home use are now very affordable. Take your blood pressure in the morning when you wake up and in the evening before going to bed. If your average over a week is above 130/80, be sure to see a cardiologist. And here's something most people don't know. Beet juice is one of the most effective foods for lowering blood pressure naturally. Beets contain high amounts of nitrates. These nitrates convert to nitric oxide in the body and relax the blood vessels. In a study conducted at Queen Mary University, participants who drank 250 milliliters of beet juice daily saw their blood pressure drop by an average of 10 millimeters of mercury in just 4 hours. But be careful, there's a common mistake. Most people mix beet juice with sugary fruit juices or buy pasteurized ready-made products. This doesn't work. Nitrates are heat sensitive. Pasteurization destroys them. Juice fresh beets yourself or choose cold-pressed organic products. Drink it in the morning on an empty stomach. You will see a noticeable improvement in your blood pressure readings within 4 weeks. Moving on to number 6, arteriovenous crossings. This is a slightly technical term, but let me explain it simply. At the back of your eye, arteries and veins cross each other. In a healthy retina, the vein flows freely at these crossing points. The artery does not compress it. But when hardening of the arteries begins, the artery stiffens and compresses the vein passing beneath it. We call this arteriovenous nicking. This finding is one of the earliest indicators of atherosclerosis, or hardening of the arteries. The Beaver Dam Eye study found that 32% of people with this finding experienced a cardiovascular event within 10 years, a heart attack or stroke. And most of these people had no other symptoms. Their cholesterol was normal, their blood pressure was borderline, and their weight was acceptable. But the retina didn't lie. Is it possible to prevent or slow down these changes? Yes, absolutely. Omega-3 fatty acids are one of the most powerful nutrients for maintaining vascular elasticity. But there is a critical detail here. Most people only take fish oil capsules for omega-3, and the vast majority of these capsules contain oxidized, i.e., rancid oil. Oxidized omega-3 does more harm than good. The correct approach is this: consume fatty fish at least 3 times a week, salmon, mackerel, sardines. But the cooking method is critical. Do not fry the fish. Frying in oil destroys omega-3s. Instead, bake or steam it. Do not exceed 160 degrees. If you cannot consume fish and are going to take supplements, look for IFO-certified products. This certification guarantees that the oil has not oxidized, and store the capsules in the refrigerator. They deteriorate faster at room temperature. A meta-analysis published by Harvard Medical School showed that regular omega-3 intake improved arterial elasticity by 17%. This means your blood vessels become younger. We've reached number 5. The connection between retinal artery thinning and white matter lesions. When retinal arteries thin, it's not just an eye problem. It means silent damage begins to accumulate deep within the brain in an area called the white matter. White matter lesions are small bright spots visible on MRI scans. Most doctors call these age-related changes and ignore them. But these lesions are actually microstrokes caused by the blockage of small blood vessels. Silent strokes. You don't even notice they have happened. The finer the arteries, the greater the number of lesions in the brain. And these lesions are a precursor to a major stroke later on. What can you do? The first step is to control inflammation. Chronic inflammation is like a silent fire that eats away at the walls of your blood vessels from the inside. The CRP test measures this inflammation. If your CRP level is above 3, alarm bells should be ringing. One of the most effective foods for reducing inflammation is turmeric. But the active ingredient in turmeric, curcumin, is hardly absorbed when consumed alone. Here's the correct way to use it. Consume turmeric with black pepper. The piperine in black pepper increases curcumin absorption by 2,000%. Yes, 2,000%. Also, take it with oil because curcumin is fat-soluble. Add half a teaspoon of turmeric, a pinch of black pepper, and a teaspoon of coconut oil to a glass of warm milk or plant-based milk. Drink it every night before bed. Get a CRP test after 6 weeks. Most people see a drop of between 30 and 50%. Moving on to number 4, retinal vein dilation and venous congestion. So far we've talked about arteries. Now let's look at veins. Dilated veins indicate that blood is having difficulty returning from the retina to the brain. This may indicate a slight increase in intracranial pressure, and if intracranial pressure is chronically high, it damages brain tissue over time. But there is a more common cause: sleep apnea. Sleep apnea means that breathing repeatedly stops throughout the night. Each time breathing stops, oxygen levels drop, carbon dioxide levels rise, and blood vessels dilate. Retinal veins are also affected. A study conducted at Johns Hopkins University showed that the risk of stroke increases fourfold in individuals with untreated sleep apnea. And most of these people were unaware they had sleep apnea. They thought snoring was normal. Ask yourself these questions. Do you wake up tired in the morning? Do you experience unexpected drowsiness during the day? Does your partner describe snoring or breathing pauses? If you answered yes to even 2 of these questions, I recommend getting a sleep study. Alcohol dramatically worsens sleep apnea. Stop drinking alcohol 3 hours before bedtime. Losing weight is also critical. For every centimeter reduction in neck circumference, apnea severity decreases by 5%. We've reached number 3, and this is particularly important: optic nerve changes and hidden pressure. Think of the optic nerve as the cable connecting the eye to the brain. This nerve can be seen at the back of the eye, and its health can be assessed. But there's a dangerous trap here. Glaucoma, or eye pressure, damages the optic nerve. This is well known. But even when eye pressure is normal, optic nerve damage can occur. We call this normal tension glaucoma. And this condition is often linked to a vascular problem, meaning a blood vessel issue. When the small blood vessels supplying the optic nerve become blocked or spasm, the nerve is deprived of nourishment and becomes damaged. This damage creates blind spots in the visual field. And here's the interesting thing: the same vascular problems may also occur in brain tissue. What should you do? During your eye exam, request not only an eye pressure measurement, but also an optic nerve assessment. A scan called OCT measures the thickness of the optic nerve fibers and detects early damage. We've reached number 2. Retinal artery emboli, Hollenhorst plaques. This is one of the most alarming findings visible at the back of the eye. A Hollenhorst plaque is a cholesterol crystal lodged inside the retinal artery. It appears as a shiny, bright, small spot. This plaque most likely broke off from the carotid artery, the main artery in the neck. If it reached the retina, it could have reached the brain. Patients with a Hollenhorst plaque have a 33% risk of stroke within 5 years, and 60% of these patients have severe narrowing of the carotid artery. If such a finding is mentioned during an eye exam, get a carotid Doppler ultrasound immediately. It's a simple, painless test. It images the inside of the neck arteries and shows if there is any narrowing. Controlling cholesterol is vital at this point. But not just total cholesterol. LDL particle number and oxidized LDL are important. A standard lipid panel does not show these. Ask for an advanced lipid test. Soluble fiber is critical for lowering cholesterol naturally. Oats, barley, legumes. Soluble fiber binds bile acids in the intestines and removes them from the body. The liver is then forced to use cholesterol to make new bile acids. This lowers blood cholesterol. Aim for at least 10 grams of soluble fiber per day. 1 serving of oatmeal provides about 4 grams. Add a tablespoon of chia seeds on top for 5 more grams. That brings you closer to your goal. But a common mistake: most people increase their fiber intake without increasing their water intake. This causes constipation and bloating. Drink 2 extra glasses of water for every 10 grams of fiber. LDL cholesterol can drop by 15 to 20% within 8 weeks, without medication. Of course, under your doctor's supervision. And now, we've reached number 1. This item is perhaps the least known but most critical on this entire list. Number 1, retinal artery diameter asymmetry and transient ischemic attacks. Let me ask you a question. Have you ever experienced temporary blurred vision, lasting a few minutes, then going away on its own? Maybe like a curtain over one eye, or maybe flashes of light. Most people attribute this to fatigue, stress, or dry eyes, and ignore it. But these temporary symptoms could be transient ischemic attacks or mini strokes. Blood flow to the retina or brain has been temporarily interrupted. The damage is not permanent, but it is a warning sign. An asymmetry in retinal artery diameter, meaning a difference between the right and left eye, could be a precursor to these attacks. What should you do? Request a comparative fundoscopy evaluation of both eyes. Most eye exams only look at one eye or evaluate both eyes separately but do not compare them. You specifically ask about asymmetry. If there is asymmetry or if you have experienced temporary visual symptoms, aspirin use may be considered. Low-dose aspirin prevents clot formation. But don't start this on your own. There is a risk of stomach bleeding. Your doctor should evaluate the benefits and risks. Foods with natural blood-thinning effects may be helpful: garlic, ginger, green tea. But these should also be taken in moderation. Excessive amounts increase the risk of bleeding before surgery. And perhaps most importantly, when you experience these symptoms, take notes: the date, time, duration, which eye, what you were doing. This information is invaluable to your neurologist. Now, let's put all these 7 points into perspective. Your eyes are the windows to your body. This may sound like a cliché, but it is biologically true. The retina is an extension of brain tissue. They share the same vascular network. Every change we see in the retina provides clues about what is happening deep within the brain. Unfortunately, modern medicine does not look through this window enough. Eye exams focus on visual acuity, and brain assessments focus on neurological symptoms. The bridge between the two is often ignored, but you can build that bridge. At your next eye exam, ask 5 critical questions. Are there any retinal microbleeds? Are there any changes in arteriovenous crossings? Is there any narrowing or asymmetry in the artery diameters? Are the veins dilated? Does the optic nerve appear healthy? These questions take your doctor's attention beyond the standard protocol, and they provide you with potentially life-saving information. As for what you can do at home, monitor your blood pressure, adopt an anti-inflammatory diet, increase your omega-3 intake, assess your sleep quality, and engage in regular aerobic exercise. None of these steps are complicated. They aren't expensive, but they require consistency. And never forget this: 80% of strokes are preventable. This isn't fate. It's the result of risk factors you can control. Your eyes are trying to tell you something. Choose to listen to them. Now, I have a request for you. What was the most surprising information you learned in this video? Which of the 7 points was the most new to you? Share your thoughts in the comments. And if you've encountered these findings during eye exams, write about your experiences. Your story could save someone else's life. If you found this video helpful, don't forget to like it and subscribe. Turn on notifications to stay updated on new videos. Stay healthy.